You know, I once interviewed a psychic.
What did you ask her?
Well, I asked for some stock market tips, but she wasn't that much help. Hello again, I'm Mark Huffman in the United States.
And I'm Laura McKeever in the United Kingdom, and this is RX411, your prescription for health.
With science-based health news and information from both sides of the Atlantic, direct from RX411.com. And today we're going to gaze into our crystal ball and try to predict some of the things we could see in health and medicine in the coming year. Well, actually, we don't use a crystal ball, do we?
No, we tend to be a little bit more scientific than that.
In fact, science and technology continue to make their influence felt in healthcare. And you've said one of the biggest trends you expect to see in 2019 is the use of digital technology in health services.
Yes, and it seems that digital health is really coming into its own, and it's set to shape itself a bit more in 2019. So one of the statistics I read is that to date, there's about 25,000 apps delivering some form of digital health service, and a proportion of those feature interactions with clinicians. And one of the areas where this could really transform healthcare in 2019 is mental health. And I've blogged a lot recently on RX411 about how the winter period increases a person's risk of depression. And while doing my research for those blogs, I found that access to mental health services is really poor in the States and in the UK. So some apps allow people to engage in therapy sessions with qualified mental health practitioners. So ideally, this would make it easier for those who feel a sense of stigma, those with strange working patterns, and those in rural areas to, get some mental health support. But it's worth sort of exercising a bit of caution here when using these apps and signing up for them. It's always important to make sure that the person giving you care is actually qualified to do so. It's an area that can transform mental health care, but it's also largely unregulated. So check out the practitioner's qualifications before paying them for something.
I wanted to ask you about wearables, because that seems to be getting bigger and bigger, things like the Apple Watch. Do you think wearables have a growing role in health and fitness?
Yeah, absolutely. I think it will start to give people a little bit more control over how they manage their own health and fitness, and hopefully a bit more confidence. I think one of the areas where there could be a lot of growth could be with, because I've noticed a lot of apps and the more advanced watches like the Apple Watch can monitor pulse rates. And there's been a lot of talk about them potentially monitoring common arrhythmias such as atrial fibrillation. At present, there are implantable devices that patients can have put into their chest that will monitor these things and sort of, trigger cardioverting. But for those who don't need them, I'm sort of hypothesizing that maybe having a watch that could send them a little alert that says, you are in atrial fibrillation right now, or, your heart block's sort of being triggered, that could prompt them and their physicians to take, some positive steps towards stabilizing their heart rate.
Last month, I purchased a very inexpensive wearable to replace my Fitbit, which had finally given up. And this new device, which cost under $100, provides an amazing amount of data. And for me, I spent a lot of time sitting in front of a computer each day, and I need to be reminded to get up and walk around. And having this thing on your wrist is a lot of motivation. You want to see how many steps you can get and reach that goal every day. And I tend to be a little obsessive with that. You've talked about one of the biggest trends in business over the last decade, the explosive growth of Amazon. And, there are mixed feelings about Amazon. Some people love it, some people hate the company. But you think we might see Amazon playing a bigger role in healthcare this year?
Yes, and there's been a lot of speculation about this for quite some time. The rumor mill really started going in March 2018, and now we know that Amazon is going to go into the health insurance business, but they haven't really confirmed how. And you've mentioned about some people sort of having, not so great feelings about Amazon. And I did read in a book recently, this author sort of said she felt that if Jeff Bezos could use Alexa to extract souls, he would. I feel as though he's a bit nicer than that. He's a bit of a philanthropist. But some of the things that he's come out with using Alexa in particular aren't too far off the mark. So after all the speculation, we don't really sort of know what it is that Amazon is going to do exactly, but their roadmaps towards getting into the health insurance game are going to become a lot clearer during 2019. So I'll admit now that it is still quite mysterious. However, they appear to be expanding into different areas of medicine. So they're investing in sort of pharmaceutical startups. They've been working with Berkshire Hathaway and JP Morgan to develop their employees' health initiatives. They've also filed a patent to use Alexa to detect coughs and colds via voice changes. And they're looking at investing into the testing side of medical diagnostics. And now here's one that might make a lot of people's toes curl, and I'm not sure how I'd feel about it. They've introduced a product that can mine patient data via their medical records. And theoretically, all of this, if it works and comes together, including the Alexa cough detection, it could make health insurance more accessible, a little bit more cost effective, and it could inspire patients to take control of their own healthcare. However, this is all very technologically advanced. Not everybody's going to be comfortable with a big corporate giant having access to their health data, and hopefully they can opt out. So I suspect it isn't something that not everyone will buy into too readily. And I think it sort of excludes some age groups who don't feel that technologically comfortable.
That's true. And so many people are frustrated in the United States, at least, with, the healthcare system as it is. So they might be willing to, consider something that Amazon presents, as long as they don't have to have a Prime membership as part of it. Okay, what's the third trend you expect to see in healthcare this year?
So this one was one that I really like the look of, and it's the concept of value-based treatment. And it's something that a lot of developed nations have been pushing for quite a while, the UK included. I'm not sure how much it's pushed in the US. But value-based healthcare tries to improve medical outcomes according to a population's available resources. And it does that by encouraging physicians to receive payments based on the patient's outcome rather than what they treat them with. So using an example from where I am in the UK, our general practitioners will be paid more for doing a certain number of carpal tunnel release surgeries if somebody has the symptoms of carpal tunnel syndrome. And the danger of this is that somebody's being overtreated for something when they could use something that's more cost effective and also more effective for the patient. So value-based medicine won't abandon that entirely, but it will, pay physicians more based on how the patients are performing. So I'm guessing one example of this would be with diabetes. They could pay the physician based on how their HbA1c levels are and if they're within a safe range, rather than encouraging them to give the latest, slickest drug that might, not have the best side effects. And I just want to point out, I'm sure most physicians don't issue meds on the basis of, financing their own lifestyles. But anything that encourages more personalized medicine is definitely good for patients.
And how do you think medical community, doctors in particular, feel about that?
I think it'd be difficult to sort of guess how doctors stateside might feel about it, because we have two such different healthcare systems. But from my perspective and talking to people over here, it's positive, but it does seem a bit vague and unstructured. So, you can measure delivering different services and know that, they're quite likely to be the most effective thing using data a lot easier than you can sort of measure how a person's going to react to your suggestions. So I think, physicians who have been in the game for a long time and who are used to a certain model might find the transition a bit challenging. But to me, that means it's important to sort of continuously get feedback from physicians and patients on how it's actually working for them.
And the concept is actually put in practice in professional sports leagues, because a lot of players sign contracts with performance incentives. They get more money if they score more goals or they throw more touchdown passes or meet certain benchmarks. So it would be interesting to see how that would translate into medicine. I think we're going to have to leave it there, but until next time, I'm Mark Huffman, and I'll make a prediction that 2019 will be 365 days long.
And I'm Laura McKeever, hoping your future is a healthy one.
And I'll drink to that. So long, everybody.